Hello Kings, I'm Fizzy. I am a junior doctor down in Devon. I went to Leeds University in 2012, straight from school, and then I graduated in 2018 after doing an intercalated degree as well. And then did my foundation years in West Yorkshire. In terms of getting into medicine, I enjoyed science at school. I was okay at it, and I enjoyed chatting and working in a team, and I knew I wanted to do something that helped people, so it was a fairly natural fit for me. In terms of work experience, I did volunteering at the Countess and some work experience days. I was a paid carer for a teenage girl with cerebral palsy, and then I also did some volunteering at a care home. So those are the things I did and I discussed in my statement and in my interviews. What do I enjoy about the job? As cheesy as it sounds, I enjoy going to work most days. I work with a really fantastic group of people, a really big team. There's lots of people in it, and I really enjoy working with everyone. We tend to have quite a lot of fun at work. Obviously, there's really stressful and really sad stuff going on, but the team, you do bond quite a lot with the team because of those things, and therefore you get to know people really well and have generally quite a good time at work. I also really enjoy working with the patients and hearing their stories, and you do get some job satisfaction going home and thinking that maybe hopefully helped someone that day, whether we just getting them a cup of tea or chatting to them about something they're worried about or giving them the right antibiotic, whatever it is. And so that is something that is really good to have from a job. You also make really good friends when you're at medical school. You're there for 6 years or 5 years, and you get to know people really well. And so yeah, my friends from university are like a big family, so that's another positive as well. What do I find hard about medicine? As you can imagine, it's really stressful at times and sad. It can be pretty harrowing, what people go through, and that's quite difficult to cope with, especially I think when you're a bit younger and don't have as much kind of life experience. That can be quite stressful. I am only in my 3rd year, and I still find things very, very difficult to cope with at times, or I feel huge responsibility and feel anxiety over that. I really struggled with anxiety in my first couple of years of being a doctor, and really, really struggled going home and turning off. I found it very hard to switch off, and I think that's a really common thing, unfortunately. Lots of the people I speak to about it nowadays say that they also struggled, and it does get better with time because you get a bit more perspective and you learn that actually that's okay, or it is okay at times. But it is hard, and knowing that you could make a mistake or miss something that causes someone serious harm or could cause them to die is a big thing to undertake and hold that responsibility, and that is quite hard. So that is probably the worst thing about the job. But equally, there's always people to ask, and you do just have to, in some ways, find ways to cope with that anxiety and use it to make you a kind of better, stronger, better doctor. So yeah, that's probably the hardest thing. The other thing is you're working shifts, which any shift worker will tell you can be quite tiring. You work nights, you work weekends, you miss weddings and birthdays, and often it's much better than it used to be, and you can often get swaps and things, but you do still have to work, obviously, antisocial hours, and that can be tiring, and if you're already feeling stressed and low, that can make those worse. Yeah, that can be quite difficult, but obviously when you become a consultant, or if you choose your speciality training, you can choose specialities that are better in terms of work-life balance, or sometimes you'll find that actually the work's so interesting you don't mind all of that. What would I give advice-wise? Obviously it's hard at the moment, I imagine, trying to get work experience on the wards because of COVID, but whatever work experience you do have, try and make notes as to things that you learnt from it, reflect on it. That's what they're looking for in interviews and personal statements, I would imagine, is not just turning up and plugging in the hours, but also actually what are you gaining from it, and what insights have you found, and how has that changed your thinking, and all that kind of thing. So make the most of the work experience in terms of doing that. If you do medicine, remember to have lots of fun and work hard as well. Medics do work hard, play hard, be sensible. And also, if you are feeling stressed or anxious about things, talk to someone. Chances are someone else will be feeling just the same, but will be too scared to mention that they're feeling like that. So yeah, don't be afraid. But most of all, whatever career you do, enjoy it. If you're not enjoying it, think if there's something else you'd rather do, and find something that you enjoy going to work in the morning. Thanks, bye.